Hello and welcome to This Dementia Life created by Dementia Action Alliance. Our website is daanow.org. I'm proud to be your host, Chuck McClatchy, and I live my dementia life with Alzheimer's disease. During this Dementia Life podcast, we'll have conversations with inspiring people living with dementia and amazing people who care for us. My guest today is Dr. Tabassum Mahid. She's the Executive Director of the Integrace Institute. Welcome, Dr. Mahid, and I guess I'll start off by please telling us about yourself and the great work you are guiding at the Integrace Institute.
Sure, happy to be here. Thanks for having me. And I am currently the Executive Director of the Integrace Institute, and as far as we know, we're the only not-for-profit research and education arm that is embedded within a senior living organization that focuses on research for people with dementia and related disorders. And so we focus on the entire continuum, so helping individuals all the way from, when they're at risk to a diagnosis, all the way through when and if they potentially would need help in the home or in residential living and anything in between. So my job is actually to guide access to research opportunities during that time, to measure whether the model is working of what we provide, to direct new services strategically, and to train all of the amazing individuals who provide that care, both formal and informal. So quite a bit of work, and we do it across the state of Maryland specifically.
That's awesome. I wish there was, somebody like that when I was diagnosed that you could go to and get some help.
Sure.
Let me ask you this. What drives you and creates your passion for bettering the lives of people living with neurocognitive disorders and dementia?
Yeah, absolutely. So I was actually personally impacted, like many of the people who work in this field. So I was a family caregiver as a middle schooler and then also as a high schooler. And then that really launched my career trajectory from that time for my specific expertise now. But really what drives me is that, we really are able through our work to create meaningful engagement and meaningful work with everyone that we interact with, and being able to have individuals who may have a diagnosis but really are not defined by it and have an amazing outlook on life, as well as a really amazing attitude towards giving back. So that really drives me every day is the folks I get to meet and the folks that I get to also mentor to take care of those folks and provide opportunities for them to give back.
Well, there's always a special place for caregivers. I mean,
yes.
When I talk to people and I talk to, trying to get that number across of how many people have like Alzheimer's and things, it's not, I don't use that word that, this is how many people have it. I use this is how many families have it.
That's right.
Because it affects everybody in the family, from like when you were involved, the smaller children all the way up to the adults. And
that's right.
It puts a completely different spin on it when you're in a family that have this, this type of problems.
Yeah, and in my family, we had an international set of, in that time, my aunts and uncles. So, there were 7 children, all of their spouses, all of their children, all of my individual impacted family, so it was everyone involved. Yeah, absolutely.
Okay. What is the hardest part of getting people to better understand neurocognitive disorders?
Yeah, what's really hard is that we do have such a stigma in our society about this particular set of disorders. And what's hard about it is that, it doesn't discriminate. It doesn't matter if you are rich, poor, if you had a career, you didn't, it impacts everyone. And I think when it's that near and dear to something that's so scary yet familiar, I think there's a lot of discomfort And I think it's really hard to have individuals really be willing to say there is something you can do. There are many things you can do. You can have support, you can have a positive outlook, and you can keep your brain healthy as long as possible. You can live very long with it. I think the stigma has faded from other chronic diseases a little bit, like cancer and diabetes. We have a ways to go with this particular set of disorders, but we're getting there. We're starting down that track and we're getting there.
I didn't have this question down, but I want to kind of ask, with some of the issues that you run into, is it are some of them religious and family units? Like, I know I was in Albuquerque and there was a lot of Native Americans and a lot of Hispanic, and it seems like there's some religions or some beliefs and cultures that they want to hide these people. They don't want them to go out, and they do it out of love. But yet it's one of the worst things you can do is isolate somebody with basically any kind of a neurocognitive disorder.
Yeah, absolutely. Well, I work in a pretty rural setting out here for the most part. And I say, that often is that it cuts across cultures, it cuts across religions, and it also cuts across geography. And I think individuals sometimes when they're connected or they've met someone, when you've met one person with a neurocognitive disorder or any type of dementia, you've met really one person with it. And everyone is a little bit different, but, the approach is pretty much one of, patience and optimism and openness regardless. And so I think there's some cultures and geographies and individual personalities, they just do better with that. And some, especially when it's a spousal issue or a child issue, there's relationships that are really tested and approaches that have just worked well for so long, whether it's privacy or, prestige even we see in the area where you're right. They don't want to say, this is something that I have, this is something that I own, or this is something that my family now is supporting me on. It's very dynamic. Yeah, it's very dynamic.
And what is the future of the Integrace Institute as you see it?
Well, for us, it's really amazing to be a community hub that gets to put evidence behind what we're doing and use a model where we're building in voices for everyone who's involved in this particular journey. So for me, it's really broad. We've recently reached out to the local Board of Education and the Business Bureau to look at a community lens on how we better support individuals. So that's really broad for me. We were also recently in a documentary about integrating kind of models that are social as well as medical. So I think just continuing to put more of a voice into every possibility, whether it be education or research. I think doing that on a broader scale would be our future. So I see it growing, and hopefully, the best form of flattery is replication or imitation. So I hope that there's other industries and individuals who really find this to be a valuable investment in their organizations to provide that hub.
And what can we, the people living with the disease, you were talking about giving people voices. What can we do to get more people passionate about, this growing epidemic?
The most powerful thing to me is always the ability to tell a story. And I think, the more individuals that are able to tell a story that is their own story so that others can then see themselves in you. That's really the most powerful part. And it takes so much courage. It takes so much processing and so much time to do it. But it's better than anything I can ever say, right? Even having been a caregiver myself, that is not what really emotionally ties people sometimes. It's really, and of course now being a professional who works with individuals, they certainly don't hear my opinion on anything, right? Want to hear from a peer, and it's very relatable, to really just continue to tell your story and continue to have patience and kind of connect individuals, form a community around yourself, even if it's small. it makes a big difference in what I've seen.
I couldn't agree more. The thing about listening to people and hearing people's stories, and when you don't have that interaction or hear from them, you're right, it gets lost of the trials that they've had.
Exactly.
And I found out by talking with people, and I'll talk to anybody about, my disease and what's happening with me,
Right.
that sometimes it's the only person they've heard talk about it, because, people don't want to, but,
Right.
I really would like to see more people get out, living with dementia, and talk to these groups and be interactive, and not for this, the sympathy part, but to show that there is a life after a diagnosis.
Absolutely.
Because there's organizations that they kind of use the sympathy part to get funding and all of this, and they don't really dwell on there's a complete happy and fulfilling life after a diagnosis of any kind of neurocognitive disorder.
Absolutely.
And to hear from people that are going through it and what they've been through, it makes me say, well, if they can do it, I can do it. And
Absolutely.
it's something that I didn't have when I first was diagnosed, which was 5 years ago.
Right. And it highlights for us, it highlights for us as the researchers and the educators, it highlights for us that there's so much we don't know if we don't listen. And so, folks, like yourself, I wish, that we knew what to tell you and to say, you will live for 20, 30, 40, years, and it'll be fulfilling and wonderful the whole time. But we can make sure that it is for as long as possible for you, and that your story inspires other people to be able to, look broadly, and to their future. I think there seems to also be a little bit, especially in my work, I see a little bit of a disconnect or a stigma with the scariness of research or information, at the same time as there's the same disconnect between diagnosis and treatment. And so I think, to be able to blend those two things together and understand that they are related, that there's things that you can do that are both, for yourself and for others, I think is so powerful. I think it's so powerful to be able to do that.
Well, I couldn't agree more. I try to tell people, because I was involved in a clinical trial for 2.5 years.
Yeah.
And I tell them that was some of the best medical attention that I've ever received.
Right. Yeah.
And it was blood tests, physicals,
yes,
the entire gamut,
right,
every 90 days.
Yeah.
And yeah, it got canceled. But I tell them, I'm going to get right back in another one.
Mm-hmm.
Because, I'm not delusional. I know that what we're doing right now probably won't help me. But I tell them by being involved in a clinical trial, I'm helping your grandchildren, their children,
right,
to possibly not have to go through what we are going through now.
Yeah, absolutely. And now there's trials that, incorporate that family perspective. There's trials that, provide services that you can't get, in certain areas. Even now with the incorporation of technology, we just ran a trial, in partnership with several university partners that offered online family counseling. We were able to put, Amazon Echoes in folks' houses to keep them independent longer. There's phenomenal day-to-day practical trials that I think the stigma of research too is something that this amazing group of individuals who are younger and active and telling their stories like yourself, is helping to debunk that too at the same time, which is that not every trial has to have a drug in it. Not every trial involves you going to the hospital for weeks. It's not like that. You can fully, live your life, and there's quality things that you can get access to because of research and because of that. So.
Do you see in the near future where they can have drug trials where people could do it almost all over the internet?
Yeah.
And, possibly mail in blood, things like this? Because one of the biggest complaints I hear
mm-hmm.
about somebody being involved is, well, I don't have anybody to take me down. You know, my spouse can't get off to make all of these appointments.
Oh yeah.
Do you see that possibly in the future?
Yeah, and actually some of the companies that we've worked with have actually taken some of that feedback into providing, let's say, transportation or removing the requirement of a caregiver, you know, who has to come with you, maybe be involved in the study if they spend some time with you per week, but actually not need to come to the study visits. But yeah, absolutely. I think that the accessibility feature, I mean, it's going to have to change, because not only do trials have to change their design to meet the needs of what we're seeing, but they also have to change their participant engagement, right? Because that is so important for recruitment and retention and continued engagement over time as these trials get longer and longer, right? And folks get, you know, younger and younger when they're joining. I mean, it's really critical. And we've seen a little bit of change too. And there's actually a national initiative on kind of diversifying trial participants that just came out of the NIH, and they have a number of strategies that they're looking at. So they're looking to organizations who do trials to give feedback on that. So I'll be participating in one of the FDA meetings coming up on that. But you know, it's true. You know, the more powerful pieces come from you and folks like yourself. So.
Okay, what would you tell somebody, you know, a caregiver or a partner that is watching this for the first time and they're seeking information, and maybe this is the first video that they've really watched?
Yeah, you know, I think that one is, don't be afraid to keep asking questions of your provider, of any provider. You know, and if you don't get the answers, be persistent. Be a little bit of a bad patient, you know, because you will get individuals who are really comfortable and have expertise in this area, and you'll get a lot more, unfortunately, who are not. So I would say keep asking questions, keep looking for information until you find what you need. And don't give up, you know, build your network, have support, and whatever is healthy for your body is also healthy for your brain. So if you're looking for kind of a mantra to start with, that's a great place to start. And there's lots of evidence out there that talks about not going straight to a medication, but really looking at your lifestyle and your behavior. Just like anything else, if we want to change something about our bodies, we have to think about how we change, how we look at them. And it's not easy, you know, but and it is something that can give you a lot of a positive outlook over time. You know, you may not see the positive now, but it will really bring your relationships with your networks closer. And we know that has an impact on mental health in a positive way. And that most caregivers feel, or individuals feel at the end of everything, that they have had more positive in their life than negative if they're looking at it with that lens. And we know that to be true. Sometimes it takes a while, but that's true.
One thing I tell people, and I'm amazed how many people I've met that are getting the medication and maybe even part of a diagnosis from the regular doctor.
Yes.
You know, somebody that really doesn't understand. And I tell them, when I have any time I have to change my neurologist, I always go on the internet and find out a doctor that specializes with Alzheimer's, you know, and they say, well, how do you do that? And well, you can go to different places, because I think it's so important to get the right person to talk with.
Absolutely.
That understands that. I think you said it so nice. When you've met one person with Alzheimer's or, you know, dementia, you've met one person.
Yes.
Because my symptoms are not what somebody else's symptoms are.
No.
And it takes that kind of trained professional to really understand and make the journey easier for both the care partner and the person with the disease.
Yeah, absolutely. Absolutely. And it is a team approach even for us as professionals, right? Because you don't just need the diagnosis, you need education for your family, and you need opportunity, to look in, kind of your home living environment. You need to be able to socialize with other individuals. You need a group of people who is going to be with you on that step of the journey. And sometimes, in a primary care physician's office, and it's not their fault, a number of primary care physicians are incredible, but they are incredibly stretched at the moment in terms of time, in terms of expertise, in terms of keeping up with the latest, so there are ways that you can have that focused attention in a way that, regular insurance will reimburse you to do that. I think that's another misnomer, is that when you do go to a specialist, you may have to jump through a lot of hoops to get there. But, we have a clinic on site, for example, that takes Medicare and private insurance, just like anyone else, for a diagnosis and for, family sessions as well. Again, another way, as you pointed out, is to get involved in research, and you get all of that for free. Sometimes you get, payment for doing that as well. So there's lots of routes to go, and there's always options. So I'd just say keep asking and keep looking.
Well, Dr. Mehta, I'm so impressed with you, and you're so full of knowledge. Thank you so much for taking time out of your busy day and talk with us and giving out all of this just great information. Thank you so very much.